We had a very normal pregnancy and had no indication that there was anything wrong. Teddy was born here in Colorado Springs. The pediatrician came and said, I think your son has what's known as anorectal malformation, and he has to go to the NICU right now.
When this happened, it completely blindsided us.
What even is that? I've never heard of that before.
1 in every 5,000 children are born without the anus. They can also have the anus in a slightly different position, usually anterior. Anorectal malformation is a spectrum. There are very benign ones, or there are very complex ones in which the rectum connects into the vaginas in girls or into the urethra or bladder neck in male patients. It can happen as an isolated condition, but most often it happens in combination with other abnormalities. That's why when the baby is born, we have to screen for all the associated anomalies.
He was immediately sent over to Children's Hospital of Colorado Springs.
She wasn't released yet, so I had to go with him. I was kind of in complete shock. I don't know a lot of the medical stuff. It was a lot to take in.
Dr. Beeler made sure to tell us very quickly that Dr. Bischoff was really who he needed to see. As a colorectal specialist, she would be the best one.
In anorectal malformation, we say you have one chance to do the right thing. That's when I think coming to a specialized center is so important, because this is our daily life. We're so familiar, so we know exactly what to look for, and we can explain very easy as soon as we make the diagnosis. Most of them can be diagnosed in utero, and at Children's Hospital Colorado we have pioneered studies to look at the anus. Unfortunately, in the United States, it's not part of the anatomic prenatal screening to look for the anus. There are a lot of hopes for families with the diagnosis of anorectal malformation. Most of my patients, they have amazing lives. In 1980, Dr. Pena, who was the founder director of the International Center for Colorectal and Urogenital Care here at Children's Hospital Colorado, he designed the operation to repair patients with anorectal malformation.
I met him, Dr. Alberto Pena, in 1985. I started to do the operation with him for the last 40 years.
Dr. Pena is the one that started the entire field. He trained me and Dr. De La Torre. The most important impact of Dr. Pena was teaching, inspiring surgeons, and following all his patients, because that's when he learned the real results of his surgery.
Research in pediatric colorectal surgery, the research is mandatory because it's a new specialty. We are trying to find always how to improve these patients, how to improve our bowel management. Our success rate right now is 90% in our bowel management.
We have surgeons visiting us from all over the world that spend time with us to learn how we do the technique, how we prepare patients, how we study them, how we follow them, how we do bowel management.
We treat so many patients from all over the world. So our numbers are superior to any other center. So we know what type of anorectal malformation, the operation, the outcome, and the current status of every patient. So currently we have thousands of patients in our database.
And that's what allows us to tell families exactly what's the prognosis for bowel control, for sexual function, for urinary function, reproductive, because we can look back at the specific diagnosis and predict how the future is going to be.
We went to the Children's Hospital main campus and saw Dr. Bischoff for the first time.
She knew exactly what the situation was. She mapped the whole timeline out. She had a plan.
Yes.
And she was very reassuring.
Completely relieved and comforted by the level of expertise that she just exudes.
For me, it's a privilege that I'll be part of their journey. So we had a long conversation, I examined him, and he had anorectal stenosis. In his case, it was very good because we knew that his sacrum was normal, he did not have tetrachord, his kidneys looked good, so the prognosis was excellent.
We scheduled the PSARP, also known as the pull-through or Pena procedure, and that is when the actual repair of the malformation takes place. We had that done at Children's. It went extremely well. We got to go home after a few days and recover at home, and he was, just his happy self.
His operation went really well. It was exactly the anatomy that we were prepared for. Once I am in the operating room, I am fully concentrated. We like to say there are no mysteries in the pelvis for us. And we work as a team. We have everyone planning the surgery, everyone preparing for that moment, so there are no surprises.
We have unique expertise amongst us. The team is formed with colorectal surgery, with gynecology, with urology, psychology, physiotherapy, and so on. Many of these kids come through with really complex medical backgrounds, be that surgical or medical. And so the opportunity to bring ourselves together, to think about a case collaboratively, and then make sure we're providing the best care for them is really, really important.
Receiving the diagnosis of an anorectal malformation is something completely new to parents. We are proactive in checking on patients every appointment that they are doing well, that they understand their disease, that at school they are supported.
As a parent, if I have a son or a daughter with a colorectal condition, I would like that he or she should be treated by a surgeon with a supportive team, multidisciplinary team that provide the care for my baby for the next 100 years.
Our philosophy in looking after these children is that we create a contract with them when we first come into their lives. As healthcare providers, it's our job to try and make sure that we offer them seamless care from that point where they first come through our door right through into their adult life, and supporting all of the challenges that they may face as part of that.
I remember asking, so are we going to you for everything now, or are we going, what does that look like? And I just remember, she was just like, oh no, he's mine.
He's mine.
He is mine.
Yeah, he's mine.
Teddy is doing superb. For many patients with anorectal malformation, it's 3 surgeries. So colostomy, the repair of the anorectal malformation, then colostomy closure. So he has gone through the 3 surgical steps, and now he is in the monitoring phase. So it's when we are gonna have the privilege to watch him grow, watch him meet his milestones like any other child, and I want to be there, applauding him to everything that he can achieve.
If you have a child with a congenital defect, the best thing that you can do for them is to find them a specialist.
We had the peace of mind that no matter what happened, that we did the best thing for Teddy, and that he was going to get the best care and the best prognosis. That's how we felt.
We're so happy, and I know that we have such a great team that'll be with him every step of the way.
If your child is facing an anorectal malformation diagnosis, or if you would like a second opinion about your diagnosis, Children's Hospital Colorado is here for you. Please contact us to discuss our processes and procedures, outcomes, and research and innovations as you determine what is best for your child.